Hospital cleanliness is one of the most important things to maintain when it comes to a veterinary hospital or any hospital in general. We see numerous patients, sometimes up to 100, come through that door, especially on surgery days. And it is absolutely imperative that we clean up behind every single one. We have patients with communicable diseases, viruses, bacteria, yeast, internal parasites, you name it, they got it. And they can transfer it to another patient if we are not careful. Anytime a patient has left an exam table, that table needs to be cleaned with Rescue. Rescue is a veterinary grade disinfectant that at different concentration kills different things. It is made in spray bottles, so the concentrated Rescue is put into a gallon jug, which is then poured out into spray bottles for use. It absolutely is imperative that every single time a patient leaves an exam table, that exam table is cleaned, sprayed with Rescue and cleaned. No patient should ever be placed on a table that has not been previously cleaned from the patient beforehand. Anything that we use restraint-wise, towels, muzzles, anything like that that has touched a patient, once that patient is gone, those things immediately get put in the dirty clothes bin so they do not get used on another patient. Any surfaces that have been contaminated with blood, urine, or feces, this includes countertops, the floor, the wall, anything that is ever contaminated with blood, urine, or feces needs to be immediately cleaned with Rescue. These are hard, fast, unbreakable rules. These are things that can never, ever, ever be compromised. Patient health should never be compromised, and when we have an unclean hospital, we are compromising our patient health. So making sure that surfaces are cleaned, that we are washing our hands or sanitizing our hands between handling patients. These are bare minimum standards of what we should be doing in a veterinary hospital. So obtaining a history is usually something that's not done until the very end of like training, because, and not even just assistant training, like technician training, because there's a lot of things and a lot of knowledge that you need to be able to apply when you're obtaining a history, to field things for your doctors, and also to answer questions for clients. When clients ask you a question that you don't know the answer to, it could be like uncomfortable and you're like, oh, I'm sorry, I'm going to go get the doctor. But then it can also make clients uncomfortable because they're like, well, why doesn't this person know the answer to my question? So to avoid like having everybody in an uncomfortable position, usually getting a history on a patient is something that's not done until much later with much more experienced staff members. But just the basics of obtaining a history, just so you know how to get a good history, is whenever you're talking to a client, you want to kind of avoid open-ended questions. So, you always want to know what the presenting complaint is. So, what's Fluffy here for today? And let's say the client's like, oh, she's not eating. Well, how is her appetite? You know, I wouldn't say, is she eating everything? Like, don't ask a yes or a no question. Give them a leading question so they can follow up with it. Like, well, how is her appetite? What medications is she currently on? What is her previous major medical history? Are you familiar with heartworms? Like, things like that. Because you're going to get more information in a shorter amount of time than if you're just getting a yes or a no question. And anytime that you're getting a patient history, you always want to know what the presenting complaint is, how long have symptoms been going on if the patient is here for being ill, and if they need to pick up any more heartworm or flea prevention. And if they say no, or if you ask if they're on heartworm prevention and they say no, I give them a 30-second TED talk on the importance of heartworm prevention in southern Louisiana and why it's deadly if their pets aren't on it. Typically, you can get a excellent, amazing 5-star history in less than 5 minutes. You can probably get it in less than 3 minutes. Short, sweet, open-ended questions. If a client wants to ramble on and on and on, I like to redirect them, because you will sometimes have clients that never stop talking. But just redirect, ask another question, and if they begin to ask questions about diagnostics or what do you think this is, I always let them know, the doctor will be in to speak with you shortly, and she will be able to answer any questions involving diagnostics. And then the TPR part. So TPR stands for temperature, pulse, respiration. These are basically vital signs. So we take temperatures either rectally or with the ear. The ear thermometer can be a little bit finicky, so I don't ever use it on sick patients or patients that are anesthetized and I'm trying to get an accurate temperature on them. You should always use a rectal thermometer if you have an ill patient or a patient that is under anesthesia or has been recently under anesthesia, because you're going to get a more accurate reading. Temperature varies in between species. Cats run a little hotter than dogs, but typically we don't consider them having a fever until they're 102.9. They run a lot hotter than we do. The P is for pulse. This can either be done with a stethoscope, or you can feel the femoral artery in the inner thigh. This takes a little finesse to figure out. If you press too hard, you're not going to be able to feel it. It's a little learning thing, and you got to do it over and over and over and over and over again, and then it'll become muscle memory as to where that femoral artery is and how much pressure to place on it to get it. You can also grasp the chest and feel the heartbeats. So when you're listening or feeling a heart, the heart has two sounds: bump, 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 bump. That was 3 beats. So you're going to actually hear 6 sounds, because that one bump, bump, sometimes people call it lub-dub, is the sound of 1 beat. So whenever you're listening to a heart rate and you're trying to count a heart rate, pick one heart sound to listen to, either the lub or the dub. Lub dub, lub dub, lub dub. Pick one sound when you're first practicing, because it can get really confusing. A lot of people will double count their heart rates when they're first learning, because they're trying to differentiate sounds, or this is just something that takes a lot of practice. So how we calculate a heart rate is we will listen for a minute and then count the beats. But counting beats for 1 minute, even though 60 seconds doesn't seem a lot, it's a long time to be sitting there counting. So there's a couple little tricks. You can either look at a watch and count to 30 seconds and multiply your number by 2. You can count your heartbeats for 15 seconds and multiply your number by 4. Or if you're really running short on time, you can listen for 6 seconds and multiply the number by 10. Really not preferred, but if you ain't got time and you just want to quickly get a heart rate, 6 seconds and add a 0. Respirations. Again, there's 2 parts in a respiration, just like there's 2 parts to a heartbeat. So a respiration is an inhale or an exhale. An inhale and an exhale is 1 breath. So when you're going to count respirations, pick one or the other to count. Either count the inhales, where the belly gets big, or count the exhales, where the belly gets small. Same deal. You're going to count it for 60 seconds, or you're going to count till 30 and then multiply that number by 2. You're going to count till 15 seconds, multiply that number by 4, or you're going to count till 6 seconds and multiply that number by 10. And then the last thing in a TPR is mucous membranes, which it's not called TPRM, it's just TPR, but mucous membranes is part of that. So mucous membranes is like assessing through gum color and capillary refill time. So you lift up the lip and you look at the color of the gums, and then you press on the gum and release. And you count the number of seconds it takes for that gum color to refill back to its normal color. So you're going to press, it's going to pale out, and then that color is going to return. A normal capillary refill time should be less than 2 seconds. Normal gum color is pink. Oh, I didn't even talk about normal heart rates. Heart rates are all over the place in veterinary medicine. Cats have typically a much higher heart rate than dogs, but there's big variations between large dogs and small dogs. The smaller the animal and the younger the animal, the higher the heart rate versus a big dog. Think of it like hummingbirds have like something like 500 beats per minute versus humpback whales that have like 3 beats per minute. The larger the animal, the less blood pumping that happens, because their heart is so big that one pump gets it going. So your larger dogs can even be in the 50s with their heart rate, and your smaller dogs can even be in the 200s with their heart rate. It's just something over time that the more patients that you experience and get TPRs on, you'll see the differences in heart rates. And like dogs that are chill versus dogs that are nervous. A nervous dog will have a screaming high heart rate, even if it's a big dog. It's just, there's variations for normal. So understanding vaccines, immunology is a very complicated subject. So to put it simply, when puppies and kittens and even human babies are born, they are born with passive immunity handed down from their mother that they got when they were inside the womb of their mom. So from birth to 6 weeks of age, they don't have their own immune system. They have the passive immunity that they got from their mom. But at around 6 weeks old, puppies and kittens start to build up their own immunity, and they start to lose their mother's passive immunity. So they lose mom's antibodies and start building up their own. So right around 6 weeks is the window where potential viruses can infect puppies and kittens. And this is the window where we start vaccinating. If we vaccinate any earlier than 6 weeks, our vaccines aren't going to do anything because mother's passive immunity would just destroy the vaccine before it ever had time to act on the puppy or kitten's own immune system. So 6 weeks, as mother's passive immunity starts wearing away, is when we start giving vaccines to puppies and kittens so they start building their own immunity to viruses. Puppies and kittens require vaccines every 3 to 4 weeks from the time they're 6 weeks old till they turn 16 weeks old. At 16 weeks old, officially there is no more antibodies from their mom. Those antibodies are gone and they are cruising on their own fully fledged immune system. So vaccinating every 3 to 4 weeks from 6 to 16 weeks ensures that we're giving our patients immunity throughout their early weeks, while their mother's antibodies are both simultaneously leaving the puppy or the kitten and also fighting off pathogens and vaccines on the puppy and the kitten. So puppies, for a puppy visit, they are vaccinated for distemper, parvo, parainfluenza, and adenovirus type 2, so that's DA2PP, a single vaccine, every time they visit the clinic. So from 6 to 16 weeks, every 3 to 4 weeks, they are receiving that DA2PP vaccine. On their final visit, when they're 16 weeks old, they get that DA2PP vaccine, plus they get Bordetella, an intranasal vaccine that goes in the nose for kennel cough, and a 1-year rabies vaccine. And then after they receive that at 16 weeks old, they are officially fully vaccinated. We do not need to see these patients back until 1 year post that first rabies vaccine. That would be considered their first annual visit, and during that visit, they will then get distemper parvo, parainfluenza adenovirus, so the DA2PP, the Bordetella intranasal, except for this time they won't be receiving a 1-year rabies vaccine. They'll get the 3-year vaccine, because in the state of Louisiana, the first rabies vaccine must be boosted within 1 year, and then after that they only need a booster every 3 years. So puppies and kittens, 1-year rabies vaccine. After they're adults, 3-year rabies vaccines for the remainder of their existence. There are 2 other vaccines that are available for puppies and dogs that aren't considered core vaccines. These are not a part of our annual package or our puppy and kitten package, or I should say puppy, I'm referring to only dogs. So they're not part of our annual package and they're not part of our puppy package, but we do carry them in hospital because there are certain boarding facilities that require these vaccines, or people go to areas where these viruses are more problematic. And these vaccines are the leptospirosis vaccine, which is a virus that affects the liver that's transmitted by like rat and mice urine, and then the H3N2, H3N8 vaccine, which is like the canine version of flu. So to get these vaccines as a puppy, These need to be administered twice. So once at 12 weeks and once at 16 weeks. If they only get one set of lepto and one set of H3N2, H3N8, they're not fully vaccinated for those viruses. They need 2 sets within 3 to 4 weeks apart. This goes for any age dog. If a dog has never received lepto or the H3N2, H3N8 vaccine, they need it twice. Once, and then once again, and then within 3 to 4 weeks. Otherwise, it's pointless. No good. Those vaccines must be boosted. Kittens are vaccinated for feline viral rhinotracheitis, calicivirus, and panleukopenia. So that's FVRCP, one vaccine. Each time they visit on their visits from 6 weeks to 16 weeks, every 3 to 4 weeks. On their final visit, when kittens are 16 weeks old, they will get that FVRCP vaccine, and they will also get a 1-year rabies vaccine. So the same goes for kittens as goes for puppies. They do not need to return for vaccines until 1 year after that first rabies vaccine. So if they got vaccinated on June 20th, 2019, we don't need to see them back until June 20th, 2020. This will be considered their first annual visit, and then here they will get an FVRCP vaccine, and then a 3-year rabies vaccine. Same deal. Their first rabies vaccine when they're little is 1 year, and then it gets boosted 1 year later to a 3-year. So a 1-year rabies vaccine, a year later, a 3-year rabies vaccine, and then 3 years subsequently after that. So kittens also have a vaccine available to them that isn't part of the core vaccine package. So this also costs extra. It's not part of the feline annual. It's not part of the kitten vaccines. This vaccine is for feline leukemia. If you have a cat that goes outside, is an indoor-outdoor cat, or if you have a client that has a cat that is indoor-outdoor, you should definitely recommend that they get the feline leukemia vaccine. In order for us to give the feline leukemia vaccine, we have to test the kitten first. So how we test is with a blood test. It's a snap test, just like a heartworm test, where we just collect a small sample of blood, mix it with some conjugate, drop it in a test, and then snap it, and we get dots for our answers. But we want to test for feline leukemia before we give the vaccine, because now it's not very common, but it can happen where you give a patient the feline leukemia vaccine, and then in the future, they test falsely positive for the virus. So we would want to know their viral status before we give the vaccine, so that way in the future we know if they're ever tested for feline leukemia that, okay, they got the vaccine, it's probably from the vaccine that they're positive and not they're sick and this feline leukemia virus is creating their symptoms. Like, we always want to know their viral status before we administer the vaccine. So fecal flotation exams are a test that is done frequently throughout the day in all veterinary hospitals. So a fecal test is done on any patient that's getting an annual vaccine, any puppy or kitten that's in the middle of their vaccine series, or when a patient is suspected to have parasites. So what the fecal flotation exam is doing is it's looking for parasite ova or eggs that are found microscopically in feces. So how we make this test happen is we use a fecal loop and collect a very small amount of feces, usually about 1 gram, and it is mixed inside of a tube with a solution called fecasol. Fecasol has is like a 1.25 specific gravity, which is like the weight and density of a liquid. And the specific gravity of fecasol allows all the actual fecal material to float to the bottom of the tube, and then allows all the parasite eggs to come float to the top of the tube within 5 minutes. So after that fecal matter is mixed with fecasol, it is filled all the way to the top of the tube, so it's almost spilling over, and then a little glass cover slip is placed on top of the tube, and the timer is set for 5 minutes. Now these eggs that will float to the top of the tube will stick to that cover slip. So after that 5 minutes is up, you take that cover slip, place it on a slide, and then you can look under the microscope to see if you have found any eggs. Working with a microscope takes experience and time. It can be a pain in the ass, especially because not all microscopes are the best. Some microscopes will give you a lot of problems. They need a lot of cleaning and maintenance. Just some lenses are just have seen better days. So this is a skill that is going to take some time to perfect, to find. And typically when you're looking and you're just starting out looking at fecal floats, you're going to see things that you're not quite sure if it's an egg or if it's a piece of poo or if it's an air bubble. But these are just things that time and experience and help from other technicians and veterinarians will help you distinguish what is what when you're looking at a fecal. When you're looking at a fecal and there is nothing seen, like there's no eggs visible, it doesn't actually mean that the patient is negative for internal parasites. Okay, all it means is that that specific sample did not contain any eggs. So we don't consider fecal exams quote unquote negative. We don't list them as negative in medical notes. We list them as NVO, which means no visible ova. Each parasite ova has a different look and a different way to diagnose it. There's specific features of parasite ova, and each parasite does different things, and certain parasites need different medications to treat. So it's not one whole blanket, my dog has worms, here's one medication and we're done kind of a thing. We need to know exactly what parasite we're dealing with to give you the correct medications and to give you the correct instructions on how you need to handle feces in the future. So there are 4 common types of worms that you're going to see in clinical practice. Rounds, hooks, whips, tapes. Each of them have their own characteristics and own treatment protocols and own methods of transmission. So first up is roundworms. Roundworms are this top image that's circled with a border around it. And they're very commonly seen in puppies because they're transmitted by the fecal-oral route, so like eating poop or stepping in poop and then licking it. But they can also be transmitted by drinking from mom. Roundworms are killed by pyrantel, which is given to all puppies and kittens during their vaccine series. So not only will they get their vaccines, but they will also get a dose of pyrantel, even if we don't see roundworm eggs on their fecal. Adult roundworms have like a noodle-like appearance. So sometimes clients will be like, I saw a noodle-like worm coming out. It looked like spaghetti. So a spaghetti worm is typically a roundworm. Fun fact, monthly heartworm prevention will kill roundworms. So if you have a dog on heartworm prevention, they're not going to get a roundworm infection. Next up is hookworms. That's the second image. It kind of looks like an oval shape with a bunch of little circles in it. And it's typically a little bit smaller than the roundworm up top. So hookworms are also transmitted through fecal-oral route, but sometimes they can also like go into the skin and burrow into the skin, like even in human beings. So if you like are walking in your yard and your dog has hookworms and you step in their poop, that hookworm can actually like burrow into your skin. They call it ground itch or creeping cruds, and it's incredibly itchy. So always instruct clients, especially if they have children, to please pick up poop if you find parasites, especially hookworms, in their dog, because their kids can step in that poop when they're running around the yard barefoot and then get hookworms like embedded into their skin, and it's incredibly itchy. So hookworms are dangerous because they can actually be fatal to puppies. Hookworms, the adult worm embeds into the small intestines and attaches to the intestinal wall. They have like a row of teeth and they stay attached and they just drink the blood from the intestines. And if you have a high worm burden, if you have a lot of hookworms in a puppy, this can actually make them anemic. Like it will drink them dry. And sometimes hookworm infestation is so bad that puppies will need a blood transfusion or they will not make it. This drug, or this worm is treated with pyrantel or Panacure, but also monthly heartworm prevention kills hookworms as well. So if you have a dog on heartworm prevention, you don't have to worry about a hookworm infection because the heartworm prevention will kill them. All right, whipworms. This one is, again, another fecal oral route, and it's also treated with Panacur. Pyrantel won't kill a whip. So when we give our puppies Pyrantel during their puppy visit, rounds and hooks are going to be taken care of. Whipworms will not be taken care of. Whipworms can only be killed with Panacur. Also, heartworm prevention does not kill whipworms. So if you have a dog on heartworm prevention, they can still get whips. That's this third image right here. This the thing that kind of looks like a football. When I would train people, I used to say it's like a whipworm looks like Hey Arnold's head. But now that I'm like in my 30s and everybody's like coming in younger than me, I'm like this old millennial that's like, Hey Arnold, haha, and Gen Z's like, I don't even know what you're talking about. So I stopped using the Hey Arnold reference because I've had a couple of people who are like, yeah, I don't get what you're saying. But if you know who Hey Arnold is, that's what a whipworm looks like. If not, just make it look like a football with plugs on the end, and that's a whipworm. All right, next up is tapeworms. So tapeworms are going to be these little grains of rice things. So you'll always hear clients say, oh, I'm finding worms around my house. They look like little grains of rice. They're all around my dog's butt or my cat's butt. So that is a tapeworm. Grain of rice, tapeworm, spaghetti, roundworm. So tapeworms are not transmitted by feces. They're the only thing on this list that you don't get from a fecal oral route. Tapeworms have to have an intermittent host. So a flea or even a mouse will eat segments of a tapeworm, and then that tapeworm will grow inside of the flea or mouse, and then the cat or dog eats the flea or the mouse and then becomes infested with tapeworms. So if a dog eats another dog's poo that had tapeworms, that dog's not going to get the tapes. He's only going to get tapes if he eats an infested flea. So this is why whenever we see a patient with tapeworms, we need to instruct their client, that dog's owner or that cat's owner, that they've got to be put on flea prevention, because they're just going to reinfest themselves with tapeworms, because they're just going to turn around, chew as they're itching from a flea, swallow that flea, and then there we go, boom, tapeworms all over again. So tapeworms, the reason that I don't have a picture of the tapeworm egg here is because that you're usually not going to see the egg on a fecal. Unlike rounds, hooks, and whips, tapeworms do not have free-floating eggs in the feces in the intestinal tract. These little grains of rice are segments of an adult tapeworm. These little grains of rice are called proglottids, and inside of the proglottids are the tapeworm eggs, where then a mouse or a flea will eat, and those eggs will hatch inside of them. So they don't have eggs floating around. So if your fecal sample that you get doesn't actually contain this grain of rice, you're not going to see a tapeworm egg. So typically when a client is saying that they're seeing grains of rice, we'll just treat for tapeworms, because if we do a fecal, we're not going to get it. Like, we're not going to see a tapeworm. But this is the only worm that has that grain of rice appearance. So if they say, if their dog or cat is on preventative and they're like, I'm seeing little grains of rice, they're going to get treated. So treatment for tapeworms, again, no Pyrantel. Pyrantel won't do it. You need injectable praziquantel or Cestex tablets, oral. Client can choose either or. There's a little bit of price difference in each. But it's a one and done thing. You just give them one dose and they're free and clear of tapeworms unless they eat another flea. Also, monthly heartworm prevention does not kill tapeworms. So if you want to have a tapeworm-free patient, you need to have a patient that's on consistent consistent flea prevention, so they don't continue to eat fleas and infest themselves with tapeworms, because heartworm prevention is not going to kill the tape. But that's pretty much it for the worms that you're going to see. There are other worms out there, and then there's things like Giardia and Coccidia, but that's not as super common as these. These are like the major 4 things that you're going to see in practice. So heartworm tests are something that we do like a bajillion a day. We do it very frequently. Especially veterinary clinics in the South do it frequently, because heartworms are transmitted by the bite of a mosquito, and we have mosquitoes year-round here in Louisiana. So how this test is done is a small amount of blood is collected from the vein of a dog. typically using a heparinized syringe, because this test requires unclotted whole blood, right? So heparin is an anticoagulant that allows blood not to clot whenever heparin mixes with that blood. So we use a pre-made heparinized syringe to pull blood from our vein. That heparinized blood is then mixed with a conjugate solution that comes with the test. So it's 3 drops of blood with 4 drops of conjugate. And an easy trick to remember is blood is red, R-E-D, that has 3 letters. You need 3 drops of blood. And the conjugate is blue, B-L-U-E, that's 4 letters, and you need 4 drops of the conjugate. So you mix this conjugate and this blood together, but please make sure that when you're mixing conjugate for a heartworm test, that the bottle of conjugate is being used from the same box that that test is being pulled, because lot numbers of tests are very important. So if you're coming to the end of a box of heartworm tests and you still have some conjugate left over, throw it away if you have no more tests left with that box. Do not use a conjugate from a previous box on a new box of heartworm tests. No, that is not allowed. Per IDEX. That's IDEX rules. So after the blood and the conjugate is mixed together, it is poured into the big well circle of the test, and then that blood solution will travel down the window of a test until it gets to the little tiny circle at the bottom. Once it hits the little circle at the bottom, you press down on that test. It's called a snap test. You snap that test down and you wait 8 minutes, and you'll have your results in 8 minutes. So 1 dot in the center, that's negative. That means that there is no detection of female heartworm antigen. 2 dots is a low positive, so a dot on the left. And then 3 dots, which is a dot on the right and the left, is a high positive. But those terms are kind of deceiving. Technically, you can't measure how high or low something is based on the presence of the heartworm antigen, because what this test is testing for, it is testing the antigen from adult female heartworms. So you could have a high heartworm burden, but just few females. So it technically is deceiving when we talk about high or low. So a patient will only test positive for heartworms if that patient has been infected with heartworms for at least 6 months, because that's how long it takes for a heartworm to enter a patient, travel to the heart, and mature into an adult worm. It takes 6 months. So if your dog gets bitten by a mosquito that gives them heartworms tomorrow, that your dog will not be positive until 6 months from that bite. So for this reason, we do not test puppies that are under 6 months old. 6-month-old puppies and younger are never tested for heartworms because the test would be pointless. It would always be negative despite what their heartworm status is. So typically, puppies will go their whole first year without a heartworm test because we will put them on a preventative in their first visit. We give them prevention. Hopefully they come back and continue to give their puppy prevention because we've done a good job of educating our clients about preventative. And then they won't typically get their first heartworm test until they're over a year old at their first annual visit. Then they'll get a heartworm test. We require, not just we, I mean all drug companies require patients to be tested every year for heartworms in order for them to get prescribed heartworm prevention. So you can get 12 months of heartworm preventative within 12 months of a negative test. So once that test is expired, you cannot pick up any more heartworm prevention. Clients must have a test every single year on their pet in order to get heartworm prevention. This is a rule put in place by the pharmacy companies that distribute the drugs. It's very important to know a patient's heartworm status before they're put on heartworm preventative. So in order to understand like heartworm prevention and heartworm treatment, you got to kind of understand the life cycle of the heartworm itself. So Heartworms are parasite, and they're transmitted by the bite of a mosquito. So heartworms go through several larval stages in their lives, and part of those larval stages must be completed inside of a mosquito. A heartworm positive dog cannot give another dog heartworms. A dog can only get heartworms from the bite of a mosquito. So how this works is a mosquito, he's chilling, he's flying around, he lands on a dog that is heartworm positive, that is infected with adult heartworms who are producing baby heartworms that are L1s that are flowing throughout that dog's bloodstream. So the mosquito bites that dog, and when he bites that dog, the L1 larvae that are circulating throughout that heartworm positive dog's bloodstream travel up the mosquito's little mouthpiece as it's taking a blood meal from the heartworm positive dog. Those L1 baby heartworms then live inside the mosquito, where they molt into L2s and then into an L3. As the mosquito is taking blood meals, he will land on another dog that is heartworm negative, and as he bites that dog, the L3s will crawl out of that mosquito's mouthpiece and into the dog that's being bitten. So those L3s will travel throughout the bloodstream of the dog that was bitten, and as they're traveling, they will grow into an L4 larva, and then they will make their way to the pulmonary artery and the heart of that dog. Once the L4s are inside of the heart, they will fully mature into L5s, which are adult heartworms. Now, since this dog is not on prevention, every mosquito that has L3s in it will be depositing more and more L3s into this dog that's not on prevention. So eventually, this dog will have multiple heartworms living inside of his heart, all adults, and these adult heartworms will begin reproducing. Okay? So when these L5s start reproducing in the heart, they release L1s into the bloodstream. Now, these L1s will stay forever L1s in the bloodstream. The L1s don't mature and grow up into this dog, remember, because they have to complete a life cycle in the mosquito. But what happens is, as these baby L1s are flowing through this dog's bloodstream, a mosquito then comes and takes a blood meal from this dog, picking up L1 heartworm, which then crawls up the mosquito's mouthpiece, and then the whole cycle starts all over again. So L1 in the blood, L2 and 3 in the mosquito, L3 in the dog, L4 in the dog, L5 in the heart. They make more L1s, the mosquito picks it up. It's kind of convoluted and complicated, but the more you read it and think about it and process it, it begins to make sense, especially when we start talking about things like heartworm treatment and heartworm prevention. So now to talk about preventative. So we briefly talked about the heartworm life cycle. In order to understand prevention, you've got to understand the heartworm life cycle. So heartworm preventions, the oral preventions that we give, the topical preventions that we give, they kill L1, L2, and L3 heartworm larvae. So that means when a dog who's been taking prevention has L3s entered into their body by a mosquito bite, the L3 larva dies. Because of the length of time that it takes for specific heartworm larval stages to mature, prevention has to be given every 30 days, or else that L3 has time to molt into an L4, which cannot be killed by preventatives. So heartworm prevention does not kill L4 or L5 larvae, right? Once you get to L4 or L5, heartworm prevention cannot help you. Only imiticide, which is the injectable drug that we use to treat heartworms, kills L5 larvae. And plot twist, nothing on the planet kills L4s. So this is why it's super important that when a patient is undergoing heartworm treatment with injectable imiticide, that they remain on heartworm prevention. Because if a patient is not on preventative, during the course of the imiticide injections, while they're being treated for adult heartworms, that patient gets bit by a mosquito that injects L3s into their bloodstream, Now, the L3 is not going to die because that dog's not on prevention. That L3 is going to molt into an L4 and nothing's going to kill it. So by the time that that dog is done with heartworm prevention, within 3 months, that dog will have adult heartworms in its heart again, producing babies. This is why it's so important to have dogs undergoing heartworm treatment also being put on heartworm prevention. Also, another good thing about having heartworm positive dogs on prevention during treatment is that preventatives kill L1 larvae. So that's the baby heartworms that are being circulated in heartworm positive dogs' bloodstreams. So when the L1s are killed, that means if a mosquito takes a blood meal from this heartworm positive dog, that mosquito is not going to then infect another dog with heartworms. So that's a pro right there for keeping a dog on heartworm preventative if they're positive. But remember, every single dog has to be tested every single year in order to get heartworm prevention. We've got to know heartworm statuses of dogs before we can put them on prevention. Alright, fleas are another huge problem in the South because fleas like a humid, warm environment. And that's all the South is, just hot and warm. Fleas have a multi-step life cycle that lasts anywhere from 2 weeks to like 6 months, sometimes even longer. So it's hard to have a battle with the fleas because they don't run on a set clock. There's not a set life cycle for them. So you could be battling fleas in your house if you have an infestation for months. Adult fleas hop on and off of pets to take blood meals and to lay eggs. So a flea actually doesn't live their life on an animal, right? They just go on to eat, lay their eggs, and then hop off. The eggs typically don't stay into the pet's fur or on the skin. Once the flea lays the egg will usually like roll off of the pet and into the carpet or on the furniture or in the bed, and then that egg hatches into a larva. That larva can move around and it eats things like dead skin cells and debris and dust, and they usually like dark places. So that flea larva will crawl somewhere where it's nice and dark, like under furniture, under doorways, under the bed, where it will spin a cocoon and turn into a pupa. Now this is where the life cycle gets complicated or problematic because the pupa doesn't have a set time of when it's going to hatch. The pupa can lay dormant for a long time. What encourages the pupa to hatch is like vibrations or opportunity where the pupa thinks it will be able to break open from its cocoon and hop on a pet and take a blood meal. And unfortunately, there's nothing on the market that actually kills the pupa. So if your client has like a terrible flea infestation and they're bombing the house, there's a possibility that they have hundreds of pupa that haven't hatched yet and won't hatch. And that flea bomb is not going to kill that pupa. So this is why sometimes having big infestations of fleas is so difficult to conquer, and it feels like it takes forever. The majority of flea preventions that are on the market work by killing the adult flea when it takes a blood meal. A flea jumps on, takes a blood meal from a pet, and then dies. It is not a flea repellent. So unfortunately, fleas will have to bite the pet in order to die. So even if you have a patient on a flea prevention and they go to somebody's house or an area that is loaded with fleas are still going to get on them, but they'll all eventually die after they take a blood meal. There are some flea preventions on the market that don't actually kill the adult flea. They just make the adult flea's eggs not viable, like a flea birth control. So I mean, some people, I think it's Program or Sentinel. That's what that is. It's a flea birth control. So it doesn't actually kill the adult flea. It just stops them from being able to make babies. Which, I mean, I'd rather just kill the flea. I don't get why these preventions are on the market. Somebody explain it to me. But no preventative and no pest control item, object, gas, fogger, bomb can kill the pupa. So that's why it's important for clients to have their pets on flea prevention year-round and to have every pet in the house on flea prevention. Every pet that they have should be on flea preventative. And they should be on flea preventative year round, so you don't end up with an infestation that takes weeks, months, maybe even a year to get rid of. So understanding life cycle of a flea is important to be able to talk to your clients about why, like, 1 month of flea prevention, I saw a flea, I'm going to get one NexGard. Okay, well, one NexGard ain't going to cut it, because in 2 months, you're going to have pupa popping out of their cocoons and jumping back on your pet. So proper client education is important to explain to them why one little piddly NexGard ain't going to really cut it if they got fleas in their house. Alright, understanding how nails work in animals. So when we do nail trims, we have to make sure that we're avoiding cutting the quick. So inside of the nail, there is a nerve and blood supply. It's called the quick. This is why you can't just cut a dog's nails to the skin. I've been doing this for like 14 years, and in my experience, I've seen 3 times clients rush their dog into the whatever hospital I was working at because they went to cut their dog's nails and didn't know, and they just cut the whole nail off, and it just started bleeding profusely everywhere, and it doesn't stop. So we try to avoid cutting the quick. Sometimes when you're doing a nail trim, it's unavoidable. In clear nails and white nails, it's more easy to see. In black nails, you can't see the quick from the outside. When you're doing a dark nail and you're clipping, I always recommend clipping just a small amount at a time. And then you can look, if you see the second picture, you can look at dead on into the front of the nail, and you'll kind of start to be able to see crumblies, and that's when you're nearing the quick, when it starts to look crumbly. Whenever you are trimming a patient's nails, and I don't even know why I don't have this typed in here because it's very important, a lot of patients don't like to have their feet touched. It's just not something that they're used to. It's not something that they're have experience with in their lives, of like people just grabbing their feet. So you're going to get the least amount of resistance on a nail trim if, when you're holding the patient's foot, you're doing it as if they were holding it naturally. So keeping their foot in a natural position. Some dogs will even let you trim their nails while they're just standing there, and you don't even need to pick up the feet. But if you do pick up the feet, keep the foot in a position that it would naturally go in. Don't rotate it medially or laterally to the side. That's not comfortable, and that's not what a dog would normally have their foot doing. So if you keep their foot neutral as possible, you're gonna get less struggle on the nail trim. If you do cut the quick, and it's gonna happen, not a human being alive has done a nail trim and not cut the quick. There are 2 options. The first is a silver nitrate stick. It's a stick that's kept in a tube. It's a tube full of sticks, and you can apply the silver nitrate stick to the quick, and it chemically cauterizes it. Downside is this stuff stains like iodine, and it gets everywhere on your skin if you touch it, and it won't wash off for days. The second option is a powder called Quick Stop. This is a yellow powder that you pack onto the nail to help stop the bleeding and cauterize it. The only downside of this is that it gets everywhere, like everywhere. It can be really messy, but it doesn't stain. But those are your options for whenever you inevitably quick your patient, because it's going to happen. But key point is keep the foot in as natural of a position as possible, and your patient will be much more compliant. So anal glands are these lovely 2 small little glands located at the 4 and 8 o'clock position on the outside of the anus, like the butthole. Fun. Normally, these glands will express on their own. So to put it very simply, sorry if this is like gross or graphic, but when a dog has a bowel movement, so when a poop comes out of their butt, it's usually a firm poop, and as the butthole opens and the poop comes out, the pressure of the poop and the butthole opening will actually press on these glands, and these glands will secrete a little bit of juice, the booty juice, onto the poop, and everything's fine and hunky-dory. It's an old evolutionary thing that dogs had back in the day to mark their territory when they were wild predators roaming in the woods. But thanks to millions of years of domestication, dogs don't really need to worry about marking their territory for other wild animals because they live in the life of luxury on our couches. But in happy, healthy, normal animals, you never have to worry about an anal gland. Hopefully for a good population of the people on this earth, they have no idea what an anal gland is. But there are some patients that, for either their genetic body conformation or having things like chronically itchy skin, and in southern Louisiana, like 80% of our patients have chronically itchy skin, but that inflammation of the skin actually creates like a swelling, a mild swelling, so that these pinpoint glands can't empty. The gland hole is too tight and no juice can escape. No booty juice can leave. So they need a little help, and that help comes in the form of us and anal gland expression. A lot of things that sometimes you'll hear from clients, like, she's scooting her butt on the carpet, I think she has worms. Well, 99% of the time, she doesn't have worms. She's scooting her butt on the carpet because she's trying to express her anal glands because they're so full and uncomfortable. So how to express an anal gland is really fun. So what you do is you always want to wear a pair of gloves, and you always want to stand to the side of the patient. You don't want to be directly in the line of fire. When wearing gloves, you're actually going to insert a finger right into the poop chute. So pointer finger into the butt, and then the thumb on the outside is actually going to massage that gland and squeeze, and you're going to get anal gland fluid out. Normal healthy anal gland fluid is very liquidy, maybe slightly viscous. But anal gland fluid that has been stuck inside the anal gland and building up for a while can be very, very thick, which is also why it can be very hard for them to express. It almost turns into like the consistency of toothpaste. It's rough. And if anal glands are left unexpressed and they're blocked, they can fill up so much that they rupture. Anal gland expression is a nice tool to have, to be able to do and to utilize and to explain to people, because it can be the cause of a lot of distress for dogs. And so this is another thing that we're talking about when we're talking about obtaining patient histories, and why it's important to be very knowledgeable before you ever get put in the role of obtaining a history, because an owner might casually mention that she's scooting, and that may just slip your mind, versus an owner's mentioning that they're scooting, and now you know, I better check their anal glands. Also, anal glands smell horrific. I can't describe the smell to you. It is a smell unlike any other. This is why you want to stand to the side and never in the line of fire. You don't want anal glands on you, because you're going to smell like an anal gland for the rest of the day. So administering pills, tablets, and capsules, that's not something that we do very frequently because we don't keep hospitalized patients, but every now and then we have to pop a pill. But for the most part, the importance of knowing this is if you ever need to instruct a client on how to give medication, because most of the time people, especially people who've never had like a sick animal or an animal who's needed certain medications, they don't know how to properly pill a dog or a cat. So most dogs are cool with having a pill being hidden in a piece of cheese or like a piece of a hot dog, some wet food. A good percentage of dogs are like, hell yeah, I'm gonna eat that up. Some dogs are really picky, and cats are just too smart. A cat will never, not even the most food motivated cat will eat a pill out of some food. So that's when like the ability to know how to manually pill something comes in. So the trick to getting a patient to take a pill that they won't eat in food is to actually you're going to open their mouth, and we're actually going to stick our fingers into their mouth to pill them. So the best way to do this is with one hand, hold the top jaw. So we're going to hold the top jaw, and very gently, we're going to lift their nose to the ceiling. The reason that we do this is when their nose is to the ceiling, now that bottom jaw is much more lax, and we can get it much more open than versus you trying to just, with a dog standing normally with their nose facing just forward, trying to get the bottom jaw open and shove something back there. You just don't have as much space. You have gravity working against you. So hand on the top jaw for both dog and cat, and lift their nose to the ceiling. And then with the other hand, you're going to take that pill and you're going to reach all the way back into their throat, and you're going to drop that pill into their mouth. Or using something like a pill pusher. If you look at the picture, this first picture with this cat, there's like a stick in that cat's mouth. That's a pill pusher. It's good if you got a really aggressive patient that you think is going to bite you if you stick your hands in their mouth. But for the most part, they're not going to bite down when you put your hands in their mouth, because they actually don't want your hands in their mouth. They're going to try to pull away before they ever try to bite you. But the pill pusher, you place the pill on the end. On the end of the stick is very soft. You place the pill, you lift up their head with one hand, and then with the other hand, instead of sticking your fingers down their throat, you're placing the pill pusher down. And it actually has a plunger that a stick comes and pushes that pill back there. After you stick the pill in their mouth, you're going to gently close their mouth and maybe blow on their nose or massage their throat, or even have a little syringe of water on standby and put that syringe of water in the corner of their mouth and just kind of squirt a little to help them swallow pills. There are certain pills that you must follow with water, specifically doxycycline in cats, because it can cause like strictures in the esophagus. But these are not things that you need to keep in the forefront of your brain. This is something that your doctor is going to let you know, or a technician that you're working with is going to let you know. But it's just, if you have capacity in your brain to keep that in there along with everything else, doxycycline must be given with water if you're giving it to a cat, because it causes esophageal strictures. So as far as oral liquids go, administering oral liquids, this is going to be something that's usually for your smaller patients or your cats. When you are giving oral meds, you always want to go to the corner of the mouth. So you want to stick your dropper or your syringe in the very corner, like you're going to kind of like where the pocket of their cheek is. And then you're going to push those medications very slowly, because you don't want to make your patient aspirate. So if you just very quickly open your patient's mouth and just squirt liquid back there, there's a chance that they could inhale it. And we don't want them to inhale liquid medication. So your best bet is to come from the side and just slowly squirt it into the corner of their mouth, and they'll just slowly lick it up. Even if it tastes yucky. You may have to do this a couple times. So let's say you do a little squirt and they're like, oh, disgusting, and they pull their face away from you. Just stick it in the corner of their mouth, do a little squirt, let them pull away, stick it in the corner of their mouth, little squirt. It may take a couple times, but it's better than just squirting everything in there at once, because they can A, aspirate, or B, they could spit everything out at once, and then that's as good as not medicating them. So eye medications, the important thing that when we're talking about eye medications is that we never want to have the apparatus of the eye medication touch the eyeball. Firstly, we can accidentally scratch the cornea if we are touching the applicator bottle or the applicator tube to the eye. But also secondly, if we're dealing with like a bacterial infection and you're touching that applicator tip to the eyeball, you're just transferring bacteria onto the eyedropper. Which you don't want to do, because then you can just reinfect the other eye. And same deal as coming with a muzzle, as coming with a leash. We don't want to come from the front of the patient. The patient does not ever want anybody to be coming dead on in the front of their face. It's uncomfortable. So your best bet is to come from behind. So approach the patient from behind and then put the eye medication in facing when you're behind them. So they just don't, by the time that they realize that something is in their line of sight, the medication is already being entered in their eye. You get the drop on them. They don't see it coming. There's going to be some times where you have patients that are going to be sent home with multiple eye medications. So if you have to administer multiple eye medications to a patient, you also want to instruct your clients to always wait 5 minutes between each medication. Also, if one medication is a liquid and the other is an ointment, you want to put the liquid in first. So you put the liquid in, wait 5, and then put the ointment. You don't want to do ointment first and then liquid, because the liquid could wash out the ointment, and the ointment is like hydrophobic, so it kind of like, you can't mix oil and water kind of a thing. So if you put liquid on top of an oily ointment, that liquid won't absorb into the eye all the way. So always liquid first, then ointment, and wait 5 minutes between. Ear medications is something that we deal a lot with, especially just in-house ear cleaning. Living in the South, a lot of our patients have skin issues, and ear issues go hand in hand with skin issues. So the two primary ear medications that you're going to be administering are ointments and cleaners. So you always start with a cleaner. Even if your patient is being sent home with an ointment, we're going to clean that ear first. And typically, if your patient's being sent home with an ointment, they're also probably going to be sent home with a cleaner. So it's always also important to instruct your client to administer the cleaning liquid first and then the ointment. Same deal as the eyeballs. Liquid first, then ointment. So in order to clean ears, you're just going to take a bottle of cleaner and put that applicator tip directly into the ear canal and squeeze. You're just going to give a nice big flush of ear medication, and then you're going to massage that ear around. You're going to really rub that ear in good, so it's almost like a washing machine of all that cleaner getting swooshed around in the ear. And then when you let go, your patient's usually going to shake their head because there's water in their ears, but it's good because we've shaken all that gunk up, and when they shake their head, they're actually going to knock some of that stuff out of there. After they do a little head shake, you're going to take some gauze squares, and you're just going to reach down in there. You go deep in the ear canal. Now, the beauty of dog ear canals is, in human beings, you can't just be shoving things as deep as you want in an ear. We have our eardrum, our tympanic membrane is sitting right there, and we can easily puncture it. That's why they say for people not to use Q-tips. Dogs' anatomy is a little different. Their ear canals are shaped like an L, so you will never be able to reach that eardrum / tympanic membrane because you can't make that 90-degree right turn or left turn into the ear. So you can reach as far as you want in there with your gauze square. I like to use woven gauze because it picks up a lot more debris, but just getting in there and cleaning, even using a cotton tip applicator and really reaching in there and cleaning. I don't ever like to instruct clients to use Q-tips at home, because even though they won't be able to reach the eardrum if they stick a Q-tip down there, if they don't have somebody that's doing proper restraint techniques at the home, which they probably don't, the dog could easily shake their head and break off a piece of that Q-tip, and then that Q-tip slowly migrate its way down to that 90-degree turn in the ear canal. So whenever we're instructing clients to clean ears at home, we're just telling them to flush it out, shake it up, maybe wipe it out with a piece of gauze, and that's it. But when they're in the clinic side and we're doing that initial cleaning, oh yeah, we getting that cotton tip applicator and we are going in there. We are getting that gunky nasty out. Once them ears are flushed and we've cleaned out with a gauze, we've used a cotton tip applicator, then we can apply our ointment. And then we're going to, again, stick that ointment deep in there. The applicator is going to go deep in there. And then you're just going to kind of massage it in. And sometimes dogs that have really bad yeast infection in the ears, we're also going to do it like in the inner ear flaps because they have all that yeast right there too. And you just rub it in, nice massage it in. Now, after we've cleaned ears, so in clinic side, we use like a communicable ear cleaner. There's just an in-house ear cleaner that we use. Anytime after cleaning a patient's ears, you are going to take alcohol and you're going to clean the entire applicator tip of that ear cleaner, because that ear cleaner is going to go into another patient's ears that may have a different bacterial infection or a different yeast infection than the patient before them did. And we don't want to introduce another patient's yeast into a patient's ears. That's not what we want to do. So we always want to alcohol off our community ear cleaners after using them, because they're going to get funky.